Started. A copy of the Open Meetings Act is located at the entrance of the door here. And we have 3 items on our agenda today: the Blue Cross Blue Shield IT platform update, the benefits consultant RFP review and recommendations, and any other business that anyone would like to bring up. So with that, we will go ahead and just go around the table and introduce ourselves so everybody knows who's here. I'm Mary Ann Borgeson, Douglas County Board.
Joe Lorenz, Douglas County Finance Director.
Claire Duda, County Board.
Mark Kraft, County Board.
Marco St. Martin, County Labor.
Kim Bolo, County Clerk.
Diane Carlson, County Administration.
Patrick Bloomingdale, County Administrator.
Karen Butch, Human Resources.
Dixon, Human Resources.
P.J. Morgan, County Board.
Mary Barnes, Blue Cross Blue Shield in Nebraska.
Elise McCatton, Blue Cross Blue Shield in Nebraska.
Karen Hirsch, Solar Sun Group. Catherine Hall, County Administration.
Mike Petro, Aflac.
Morning. Sarah Prodani with Aon. Jolene Front with Aon.
Emily Perry, Holmes Murphy.
Bo Reed with Holmes Murphy.
Phil Crone with Blue Cross and Blue Shield of Nebraska.
Dan Dahl with Holmes Murphy.
All right, we will go ahead and get started. The first item is the Blue Cross Blue Shield IT platform update. Who's gonna give?
I'll start. Do you want us just
Yeah, just come on up to
Okay.
the table.
All 3 of us are going to have a quick roll, if that's okay.
Oh, yeah, absolutely.
Can you come up?
Yeah, absolutely.
So, thank you for having us. And so, as some of you have heard, we are going through a claims platform change that will take, it's actually taken effect as of May of this year for some of our groups. And a lot of our ASO groups will start moving 7/1, and Douglas County will be 1/1 of 20. And so, we, in full transparency to Douglas County and the board, wanted to make sure that you guys were aware of what we're doing. Like most companies, we always want to maximize efficiency and effectiveness. Our current claims platform has been in existence for about 10 years now. And because of that, like most software and technology, we are moving to a new one. This is an American-based company called Health Edge. Health Rules is the actual software. So if you hear Health Edge or Health Rules, you'll know that that's basically one and the same. A lot of reasons that we are moving to that. One of the biggest things is the political atmosphere that we're in, federal political atmosphere. There's constant changes, and this platform provides flexibility to adjust to those as things are upgraded or changed. We can move to that. Additionally, as you guys have probably seen, there are a lot of healthcare vendors out there. This will improve and increase our efficiency to integrate with other vendors as they pop up, and if Douglas County is apt to consider one of those. So those are some of the reasons. We thought what we do is take a very short amount of time and then field questions on why, which is really what I'm going to cover, and what Health Rules is, and then prepare you so as a member from Blue Cross Blue Shield Nebraska why. So obviously jump in anytime with questions that you have, and from there I'll kick it over to Mary.
All right, great. As Phil said, this transition for Douglas County will go into effect January 1st of 2020. There will be, with the system change, the need to, first of all, issue ID cards. There will be new member ID numbers for all of our Blue Cross and Blue Shield members transitioning to the new system. We have been working closely with Colleen and Karen's team to put in kind of 2 different scenarios to make sure that ID cards are in hand for 1/1/20, so that there will be no disruption from that perspective, that folks will be able to go to the pharmacy on January 1st with their new ID card and get that prescription filled if that's what they wish to do. So again, we've been working with Colleen, and depending upon when that open enrollment electronic file feed will get to Blue Cross, we may be able to use that, or like I said, we do have a plan B to make sure that we've got ID cards issued and in the members' hands in time. As we were looking at this transition, we took it as an opportunity to also revamp some of our member-facing documents. So in addition to the new ID card, and that's gonna look very, very similar to the current ID card, but we're revamping some of the other member-facing documents, such as the schedule of benefits that comes with the member ID card. It's gonna have a new, cleaner look. The explanation of benefits when a claim is processed and adjudicated. And when we took a look at wanting to revamp those documents, we actually got feedback from our members about what they wanted to see, where they looked on the page to want to see that information, and so really we redesigned these based upon our member feedback. The other opportunity that we're going to take advantage of is to make sure that we have the coordination of benefits updated, so we will be reaching out to members and updating that coordination of benefits to make sure if there's other insurance that we have the most updated information going forward on our new system. One of the biggest changes that we'll be able to take advantage of with the new processing platform is we'll be able to coordinate benefits for pharmacy right at the point of sale. What's happening today is it's more of a back-end manual process that the member has to initiate if they want to coordinate benefits on pharmacy, and we'll be able to do that right in real time at the pharmacy going forward beginning January 1st. So that's an opportunity for additional claim savings for Douglas County. A small change regarding the telehealth through Amwell. That's the virtual doctor's visits benefit that's available for Douglas County members. Because of the new ID number, members will need to go into their account that they've already established and just simply update that new ID number so that if they need to utilize that benefit, it goes through properly. So that would be one thing that part of our communication to members that we want to remind them of that. And then in general, we again took this opportunity to look at what was being sent out to the members, and so for new members versus just sending a envelope full of a lot of loose leaf brochures from Blue Cross, we've come up with a nice get started guide for your new enrollees that we think is going to be very helpful for them. It puts everything in a nice one spot for them to be able to reference. I'm going to leave some packets of information here that you can review at your leisure, but included in the packet will be this document that I just talked about outlining those changes for members. I'll talk about some changes for groups as well. An example of the new explanation of benefits will be in that packet. And then this is just an example of the member-facing materials that's going to go out with their new ID cards and schedule of benefits. So all that will be available for your review as well as one of the Get Started guides. A few changes for our groups and group leaders. With the new system, all groups will receive a new group ID number. So as soon as we have that available, we'll make sure that we update Karen and Colleen. We are working as we speak to make sure that those electronic eligibility files, that we have that group structure set up and in place to be able to accept that eligibility file when you've completed your open enrollment. So we have a process and a timeline in place to make sure that we're able to do a test file and make sure that everything rolls smoothly for that electronic file feed. And then there will be some different reporting capabilities also, and we're again behind the scenes making sure that we're integrating our current system with our new system so that there's no lapse in the data that you receive as a client. So those are the primary changes that folks would see with this system conversion. Do you have any specific questions about anything that I touched on?
So just to clarify, what we intend to do is to renew Blue Cross for 1 year, simply because we have doing this benefit consultants selection, and regardless of who we go with as the consultant, we want to sit down with them and determine the best path forward. So we'll do a 1 year renewal of Blue Cross, and and it could be longer than that in the future, but for the time being, we'll do the 1 year renewal of Blue Cross to get us the next year, and then just see where we go from there.
Any other questions from anybody? Anything else to
Yeah, I just wanted to kind of set the stage that Blue Cross has been working very hard for our groups that are transitioning onto this platform behind the scenes in preparing for that 1-1 journey. As Phil indicated, that we have been kind of ramping up to that. We initially transitioned all of our own employees and subscribers to the new platform on 1/1 of 2019, and that's going successfully. To increase the comfort level of Douglas County, we have been and will begin transitioning groups here 7/1 of the scale that you are in complexity. So we will have a good handle on that. We've been building all of the benefit plans behind the scenes and testing with that as well.
Commissioner Kraft?
1/1/20, yes.
Yeah,
We
you
had
said
transitioned our group 1/1/19.
Oh,
The way I understand this, everything is behind the scenes. No benefits are gonna change, no providers are gonna change, and, everything on our side, other than the unique ID given to each of us and the ID given to the group, those are really the only two things that affect us if we don't need your services. And if we do need your service, you're laying out the letter you give us in a more easily readable format. Thank you.
Yeah, I think it's an excellent question, just to tack onto that. So the biggest thing to take away is you need to use your new ID card. Once you receive that at the end of this year, and there will be a date issued on there. So you can see, and that was actually some feedback from some of our broker partners to have that on there. So because they look so similar, you'll know, okay, this is the one I need to use for 2020. Outside of that, I think the members will be very happy with the EOB's explanation of benefits that are colored.
Are the phone numbers going to be in a little larger font for those of us who have grown a little bit older?
And for,
Oh, sure.
I thought you were going to answer that.
you got a bunch of old guys
You know what,
here.
due to the card size itself and the location of the number, we were unable to increase that. So unfortunately, it is not.
There's always next year, so
Right.
we can look at it, but yeah.
That's a condition of accepting that one-year thing is you make the font bigger. If you don't do that,
Okay.
I'm a no vote.
We could get, like iPad-sized cards.
Well, fortunately, we do our own printing, so that is something we can take back.
We can definitely take that back.
Commissioner Morgan?
Do you want to mention the pharmacy situation again?
Oh, certainly. So, just to reiterate, with the pharmacy, of course, we want to have everybody's ID cards in hand for 1/1. In the event, and I know it's unlikely, that people wouldn't show up with their new ID card right away on January 1st, we actually have a crosswalk built within the pharmacy system. So if they do present their current or the old ID number, it will crosswalk into the new number and they'll still be able to receive benefits. And that was one of the things that we tested right away with our Blue Cross and Blue Shield employees. We had folks show up January 1st with the old card and with the new card, and everybody was able to get benefits regardless of which card they presented. So we know that the pharmacy is the first place people are likely to touch the new system, if you will. So we wanted to make sure that that experience was good for
And
them.
you said it should save money for us being self-insured. Now, how does that work?
Because we're able to coordinate benefits on the pharmacy side now as well at the point of sale. I'll use myself as an example. If I have my health insurance and my spouse has insurance, so technically any prescription that he fills should go on his insurance because he would be primary. But today, there is nothing from stopping him in utilizing my benefits if that's the card that happens to be on file with my pharmacy. Moving forward, the pharmacy is going to have that information that my spouse should submit his card first. And so the benefits that perhaps Douglas County, might be picking up, if there's other insurance out there on the pharmacy side, we're going to be able to capture that and save some claim dollars through that coordination of benefits.
Commissioner Kraft?
Any guesstimate about how much the county will save?
I don't. I can certainly go back and see if we have some estimates based upon, what we see on our block of business, but I don't have that information
If
here
you
today.
do have it, can you please email it to us?
Sure, absolutely.
Any other questions?
And it really doesn't matter what pharmacy you go to.
We have a very broad pharmacy network. While not impossible to go out of network, you kind of have to, you
Right.
know, yeah.
Pretty hard to
It's
go
very
off.
broad, and there won't be any change to, again, to the medical, the physician or hospitals, or the pharmacy network for 1120.
Thank you.
So the mail order component of it, how's that work then?
It would just be an issue of when you need to get that, refilled, to make sure, again, that you give them the new ID number when you go to submit that request for a refill.
And that is with whom?
That is through, Walgreens Alliance Prime. It's a special mail order service that is a partnership, if you will, between Walgreens, Alliance RX, and Prime Therapeutics.
Do you save money with the mail, or is it competitive, or?
It's competitive, and, you know, sometimes it's more of a convenience item, but lots of times, through the mail order, knowing that those are going to be typically 90-day supplies that you're getting, there are some, cost benefits to that.
I would say back to your earlier question, just to tack on what Mary said, so, and you'll see this in some of the documentation, but the letter that comes out with the new ID card, it will have in red, please use the new ID card. We're actually gonna send a follow-up message to that letter to all of the members so that they can see that. So it'll prompt them to use their new ID, whether it's telehealth or pharmacy or any providers. We're gonna be hitting them, and we're gonna provide Karen and team a lot of collateral and information so that they can communicate. We'll assist however we can during that process. So, we'll
Just
communicate.
one last thing I'll touch base on. If you have established a My Blue account, which is our member portal where you can go out and you can see your claims information or print an explanation of benefits, the system will actually let you toggle between the new benefits for 1/1 and what you currently have. So if you need to follow up on claims from, 2019 that are processing during the first part of 2020, you'll be able to toggle back to those benefits and be able to access that information as well.
The only follow-up at some point that I would like to know about is how many have signed up or are utilizing the telehealth component of our insurance, and that's for another day, but I'd like to know a little bit more about that.
We can get a report on that. That's not a problem.
Okay, any other questions, comments? Thank you.
All right, I'm gonna leave these here and
Okay,
they can
yeah.
be distributed.
Thank you.
Thank you very much.
Yep, thank you.
We will move on to item 2, the benefit consultant RFP review and recommendations from staff.
Okay, so this was a very intensive review. It was really tough because all of these companies that submitted proposals were top-notch. So what we did as a review committee, we submitted an RFP pursuant to county board instruction in April. There's a 5-member committee that was formed. It was myself, Joe Lorenz, finance director, Diane Carlson, deputy administrator, Karen Butch, HR director, and Colleen Frederickson, who is the compensation and benefits coordinator for HR. We all reviewed the proposals, determined that all companies should be interviewed because all the proposals were good. We conducted interviews in May, and then we met on 3 occasions to discuss and ultimately come up with a recommendation. Before we give the recommendation, HR put a lot of work, Colleen did, particularly in the spreadsheet that Karen's going to hand out, just to show all the factors that we looked at and we discussed. Karen won't go through every single one of them, but she'll highlight some of the elements of it. She made 20 copies, so should be enough.
I'm gonna keep it.
I can have an extra.
Yep. Sure, I can check.
Do you want one?
We're good?
Is it enough?
Thanks. Okay, that's it.
Do we have enough?
Anybody need one?
You know what? I can get it afterwards. I can wait.
So can you get through?
I have enough.
You have an extra?
Me too.
Okay.
I'm good. Nope.
No.
Thank you.
I deliberately didn't send that far enough. So you'd have to reach.
And so I should have said we had 5 companies that submitted proposals: Aon, Holmes Murphy, Lockton, Midwest Benefit Advisors, and Silverstone.
Okay, the spreadsheet goes into a lot of detail for each of the different, benefit consultants. But I wanted to just highlight some of the things, you're of course welcome to read. As far as education, for cost, the Aon's contract is a 5-year contract, it continues through, and they're honoring their price in the 5th year of our contract, which expires. And they're honoring it for 3 years at the 42.4. They do, just so you know, they do receive commissions. Then Holmes Murphy also presented $41,000 annually for 3 years with commissions, and then they are also saying that they would get a 5% bonus once we receive more than $1 million in savings. Lockton has proposed $40,000 annually for 3 years plus commissions and a 3.5% of annual savings. Midwest Benefit Advisors, which we'll just refer to as MBA, they proposed $75,000 annually for 3 years, no commissions, and 15% of annual savings that we would see from any strategies that they would recommend that we implement. And then Silverstone was at $41,200 the first year, not to exceed $100,000 annually in years 2 and 3. And they did propose a traditional guarantee where if the county were to recommend a Silverstone to another organization, we would receive 20% of savings in our annual compensation, and of their annual compensation they would get back to us. And then the non-traditional was that if we decided to implement risk-based pricing, reference-based pricing, thank you, reference-based pricing, they would lower their fee to 0, and they would take 20% of the savings from the plan. So those are the basic costs associated. Now, some of them also propose additional vendors that could be utilized to enhance our benefit offerings, and those additional vendors would be passed on as a per employee per month or at a cost additional to what they are proposing in their package.
So let me just add to that real quick. The Midwest Benefit Advisors, they would contract with other vendors to actually provide the services. So Novo Benefits would provide a bulk of the claim services, and Script Sourcing would provide the pharmaceutical services. So that's a little bit different than the other companies, which are bigger companies that are more all-inclusive.
And you can see that under the MBA. So as far as services on the education open enrollment tools, we felt that 2 of the 5.
Can you, before we go on,
Yes,
we have
yes.
one question.
I just wanted to ask you, and it's probably, please don't anybody laugh about this, but commission on what?
On our life and disability policies.
From
that
the
we have.
companies that we, like Cigna or whoever they,
From the insurance carriers.
Right, and this is pretty common, is for companies to get commissions not from us, but from carriers.
Okay.
So Aon is, just so you know, Aon has been receiving about $65,000 to $70,000 in commissions and overrides for the whole entire time that we've been with them.
Okay, thanks.
You're welcome, good question. So as far as the open enrollment and the education tools, as I was saying, we felt all of them provide basic support to us, but 2 of the 5 provided some additional electronic communication that would increase our delivery of information to our employees in a very user-friendly way. As far as the legal resources, 4 of the 5 have in-house attorneys, which is an advantage because we can get questions answered more quickly. 2 of the 5 had multiple in-house attorneys available to us. As far as compliance resources, 3 of the 5, all 5 provide compliance information and services to us. For HR resources, 3 of the 5 provide some additional resources to our department at no additional cost. From an audit standpoint of claims, 2 of the 5 recommended that we audit over 50% of our claims. Right now, roughly Blue Cross Blue Shield audits about 3 to 5% of our claims is all. And they feel that we would see cost savings if we were to audit more. I think probably the 50% mark would be a huge increase over what we're doing now. As far as strategy, we looked at stop loss because our stop loss has gone up considerably. As you recall, last year we had about a 20% increase in our stop loss from Blue Cross Blue Shield and Aon's review of that and recommendations. So what we found is 2 of the 5 consultants will market to 15 or more carriers. I believe Aon and Blue Cross looked at about 5 last year, and these are all A-rated carriers. 1 of the 5 indicated that we would see a decrease of 10 to 20% in our stop loss. As far as our RX, our trend for our prescription drugs, as we talked about before, is very high. Our prescription drug trend is running at any given time between 15 to 20% of our whole entire medical spend. And so 3 of the 5 stated that they would be able to reduce claims by approximately $1.5 million. 1 of them indicated that they could reduce claims by our RX claims by $3 million. As far as data analytics, 3 of the 5 have proprietary software, and that is an advantage because if we want to have any kind of customization, it's their software and they would be able to assist with that. 2 of the 5 also incorporate our county's biometrics findings, which allows us to implement some more factors with wellness initiatives, and that is a huge plus. Both of them are able to give us a rating of our employee group as an aggregate as to like how healthy we are overall.
When you're saying 2 of the 5, we don't know which 2. When you say 3 of the 5, I don't know which 3.
Okay, so I didn't know if you wanted me to read through each of the boxes or
No, but
just name the persons.
Just name.
Okay, that's fine. I can do that. So for the data analytics, 3 of the 5 that had proprietary software were Aon, Holmes Murphy, and Lockton. The two of the 5 that incorporate the biometrics were Holmes Murphy and Lockton.
Where's the biometrics listed?
It's under the wellness initiative column.
Okay, thank you.
You're welcome.
So it's Holmes, Murphy, Lockton, and MBA?
No, just Holmes Murphy and Lockton.
Holmes, Murphy, and Lockton, okay.
From a technology standpoint, which is in the gray box, all 5 of them have the ability to analyze claims. 1 of them provides, which is, 2 of them, Holmes Murphy provides the ability for us to do real-time analysis. Infolock, they have the ability for us to do that, but Lockton, there may be a cost associated with that. They were going to get back to us, and we have not heard back from them. Disruption, which is in the pink box. 2 of the 5 recommended changes that would potentially have impact on employee disruption. for services, and those two were MBA and Silverstone. MBA has recommended that we move to pre-certification through a medical management company, and they are also suggesting that we look possibly at reference-based pricing. And then Silverstone is suggesting that we implement reference-based pricing with balance billing could be possible, and basically what that means is when you go to the doctor, there's an amount that's set, and if it's not covered under the contract, then the employee is billed for the remainder of the charge. Instead of it being written off like it is currently under our PPO provider.
And then just to clarify on that is with the balance billing, if the employee got balance billed, then Silverstone would step in and work to get that with the doctor.
To negotiate.
So that they don't have to worry about it. But you still get, if you get balance billed, even if ultimately at the end of the day it's cleaned up, you still have that stress and anxiety of getting that bill for however long you've had it. So that was just one of the concerns I had about reference-based pricing.
And those are pretty much the factors that we looked at. We looked at technology, we looked at their wellness, we looked at the disruption, we looked at the cost to services. So some other things that we felt were important to note is that Pat Bourne, who has been our representative with Aon, he is leaving Aon. And so we would have a new account executive working with Pat. So we just wanted to point that out, that would be a change. We have day-to-day contact and account managers for all of the benefit consultants. So we feel that we would have good support from most every company as far as that's concerned. So, questions?
I have a question on, I've got some interesting health problems, and sometimes I don't know whether the doctor I've been referred to or whoever it is, go to UNMC almost exclusively now, since Creighton became a hotel or whatever it is. Anyway, it'd be helpful to me, I don't know if it's Blue Cross Blue Shield or if it's one of these consultants, to tell me before it happens who's in network or not. I mean, getting a notice that you need to check it out, and that's impossible. I can't be. Have you ever tried to call UNMC? I mean, through the switch, it's like pretty strange unless you have a direct number. And that's why I pester Mary all the time. I got her cell, but I got a notice it was changed twice, but I found it. Anyway, I would appreciate knowing from someone, can you warn employees about whether the doctor you're going to see is in network, because it does affect obviously what they get paid.
Sure. Blue Cross Blue Shield does have a listing of network providers. It's on their website.
Yeah.
The other option is to call customer service ahead of going to appointment to see if it's in network.
Okay.
Those
All
are
right.
usually the best way.
Yeah.
Mm-hmm.
Okay. I'll give Mary a call.
Or we can look it up for you too. So.
All right, thank you.
Commissioner Kraft.
Okay, so sometimes you go to an emergency room, they admit you to the hospital, the doctor seeing you may not be in network. Is that correct?
Most of the hospital doctors that are on staff at the hospital would be in network because the hospitals are in network. But if there are other services that are provided like radiology or some of those types of things may or may not be in network.
So how do I know if they are or not when I'm groggy from medication, they're putting me the MRI?
That's a very good question, and there isn't a real good answer to that.
Okay, and is there any negotiation or appeal to that?
You can always appeal claims to Blue Cross Blue Shield. They have an appeal process, and that is available to any employee who wants to appeal. I think Blue Cross, and Bill and Mary or someone correct me, but I think, what's the percentage of professional medical people that are within the network at Blues?
In Nebraska, we have, between 96 and 97% of the physicians in the network.
And that includes the people who do the MRIs and the CTs and who knows what. Okay.
Anesthesia.
Yeah, okay, good. Then I have a question about these estimates of estimated cost saving, 5% bonus over 5 million, 3.5% of annual savings. What do they mean by savings? How are they measuring savings?
Their proposals, from what I can tell, is that they look at what our prior spend was compared to what implementing the strategies, and then they compare what our previous expend was to the current spend after we implement the strategies, and it's based upon that savings.
And would the need for them to get that 3.5% or 5% or 15% alter the amount of benefits we receive? Would they, say, no, you cannot get your tonsils out?
Yeah, no, these savings do not, that's a very good question. These savings do not necessarily include any specific plan changes,
Okay.
plan design changes.
Thank you. Then, one other, is there any recourse if they don't reach their claim for that savings because we're counting on it?
That was one of the questions that we talked about was, and you'll look in the green in that last box, we talked about performance guarantees. And Aon agreed that they would provide some performance guarantee, meaning that we would get some money back if the strategy didn't deliver. Holmes Murphy, we didn't really discuss that with them. Lockton said they were willing to discuss. NBA said they would be willing to discuss some kind of performance guarantees. And then Silverstone has specifically stated that if we went with a reference-based pricing, that we would not pay a fee, but they would take 20% of the savings. But I think that when we discussed it with them, they were open to look at possible performance guarantees also. I think my sense is that all of the consultants would be willing to work out some type of performance guarantee with us if their strategy that we implemented did not come to fruition.
Commissioner Morgan?
No.
Any other questions or comments?
So we went into this with the idea that we wanted some very proactive consulting from whoever we chose, with an eye towards obviously saving money, but at the same time minimizing employee disruption. Because, just beyond some of the stuff that was proposed, I wasn't really that comfortable with, because even though it seems like potentially, ideally, best case scenario, you could save millions and millions of dollars, but at what cost to the disruption of the employees? Or if they're voluntary services that the employees would voluntarily choose, I think knowing how we know our employee base, chances are a lot of them would not voluntarily do it, so the savings would not be there. So that being said, what we did as a group review committee is after the interviews, we sat down individually without talking to each other and ranked each on a variety of factors. Did I don't know if it's called a Gantt chart or a chart where you rank them. And then we met and we discussed, and I will tell you it was tough because for the most part, I think the majority of these companies, whoever you choose, would do a good job. It's just a question of comfort level. Who are we most comfortable with? And it was really close, particularly between a couple of companies at the top. But at the end of the day, I think I can say it's unanimous that we would be most comfortable with Lockton, and that would be the recommendation. We would present that to the HR committee, and the HR committee make a recommendation to the full county board, and then we could negotiate a contract after that. So that is the recommendation, but again, it was, on some of the stuff, it was razor thin, and the majority of these companies, we do think could do a great job.
And what's the timeline, Heather?
So we could guess, we'd have to negotiate a contract and get it before the board hopefully within the next month or so. We have to negotiate the contract, have the county attorney review it. We technically are without a contract now. Aon's contract expired June 14th, but there's nothing in the immediate nature that we need the consultant for until we get into potentially open enrollment, which is September, October. But I think by the end of July, first week in August, we could have a contract.
Commissioner Crowe?
On the other fee information, do we know how much the additional fee would be on these, that say there'll be an additional fee?
Some of them provided, others didn't in the proposal because they just weren't sure whether we would want to utilize that or not. So like, for example, Lockton has an employee call center for an additional fee. They would be answering questions related to our medical plans, and Blue Cross Blue Shield has a call center, so then we would have to say, what is it worth to duplicate potential
Okay.
effort?
And so, for example, Lockton does not have HR consulting risk management as additional fees, but does it include it in the program?
Yes.
Yes, it does? Okay. And it includes retirement solutions?
Oh, I'm sorry, so you're looking,
I'm comparing one to the other.
oh, for the additional HR
Yes.
services? No, they provide down below under other is theirs. They have mobile apps, they have additional communication, they have an AI service. So those things are available at additional costs. Lockton provides under the open enrollment, that's where they're providing a lot of no cost additional services to us, such as Brain Shark and other type. They have an in-house graphics team that we can utilize without any cost.
Any other questions? Commissioner Kraft, are you done?
Yes, I am.
Commissioner
I think
Boyle?
I'm done.
Okay, Commissioner Boyle?
I have a question. Who ultimately determines the premiums? Us?
It's based upon our claims experience, usually commissioner, and
Okay.
actuarial analysis, and the actuarial analysis is done by the consultant.
By whom?
The consultant.
Okay.
Mhm.
What do we expect? Premiums going up?
Yes, probably, because our medical trend, unless we make some changes, our medical trend both in RX and regular claims is trending upwards. And we do have about, right now, our large claims are a little less than they were at this time last year, and that may end up being a saving grace for us if we don't have any other large claims occur.
Have we changed any of the coverages?
No.
But it's so important. That's why it's important, because our claims are going up. I think 35 million claims spend projected next year, possibly as high as 38 million claims spend. It's really important to bring in a company that can be proactive and creative and help us, substantively put a dent in those costs, with a really important eye towards avoiding or minimizing employee disruption.
Is there any way to have a contract with UNMC or CHI and say, we'll pay you, $28 million a year for whatever?
And that's direct contracting. That's actually something Silverstone, in addition to reference-based pricing, they suggested direct contracting. Again, though, let's say you contract directly with UNMC.
Yeah.
That takes out a whole chunk of others who would all then be out of network. So again, what level of employee disruption? It's just that balancing act.
I guess what I was saying is not necessarily do both major hospitals. Maybe, is there any way to do, Methodist, CHI, and UNMC and have contracts with each one individually, or no deal?
Well, I think that would minimize the savings, because
Yeah, it would.
That's certainly something we can look at, trying to do that. But the more people you contract with, the less savings you're going to get.
Well, I guess what I'd ask is that maybe if we could figure out who goes where, maybe there's majority of employees are going to CHI or the UNMC or somebody, maybe see if it's even practical for us to make that kind of a move sometime, if it saves us big bucks, which it could.
Right.
I don't think I'd be too excited going back to CHI, but anyway.
We have done a utilization evaluation of that already, and what
Okay.
we're finding is that our employees not only use different networks.
Right.
But they also, there's a group of employees that also use both networks, so
Oh,
they
wow.
have
Okay.
UNMC doctors and CHI doctors.
Okay,
One of the unions had us look at that
oh, I see.
about a year
Okay.
or two ago.
Yeah, and we just redid the numbers and they haven't really changed much.
Thank you.
Any other questions or comments? So recommendation from the HR committee is to be recommending Lockton to the county board for approval within the next, current, I mean like June board meeting, and then we'll do,
Yeah,
not the
we could do that.
contract.
Yeah, we could do a resolution recommend, accepting the proposal and directing negotiation of a contract. And we
Right.
could do that next Tuesday.
But, yeah, I mean that, so that way it keeps,
And then the
the
county board,
process go-
yeah, so ultimately the decision isn't made until the county board
till
votes
the
on it.
county board does it,
I
right?
think we should do that.
Okay. Any other questions or
I
comments?
just make a
on it?
comment, looking at this, I'm kind of dazed, really a terrific job, I mean, it's amazing, to have digested all of this and come up with a decision, I'm very impressed, thank you, Karen, Patrick.
Yeah, Colleen, primarily Colleen.
Yeah,
I think.
primary colleague.
Thank you.
Thank you.
Thank you very much.
With that, we have one other item, other business. Is there anyone who has any other business they'd like to place? Really?
I do.
Okay.
Karen knows about this.
Oh.
I am being hounded over a 35-cent charge on my Discovery benefit. I went to a copay, and for some reason, the doctor's copay came up $30.35. And so I was hounded by Discovery Benefits to tell them what that 35 cents was for. I told them I bought a couple cigarettes from the guy. And then I also get asked repeatedly questions about UNMC, and so I did right back, and I got kind of a nasty response. I said, I bought a carton of cigarettes. And, I mean, I don't know, there's gotta be some answer to this. I know they're working with the IRS and all this other stuff, but it really is pretty maddening, and thank God those two have, I couldn't even get my card for a while either, so it was really out of this world. But anyway, I think we need to, and I understand they're doing their job, but I get the explanation of benefits from Blue Cross. I get those daily, I guess, and then I get these Discovery things, and I'm not capable of matching them together and saying, okay, here's the deal. And I don't know what the solution is, but there must be other employees who are as stupid as me.
It wouldn't be utilization, it wouldn't be utilizer error, would it?
Maybe. Anyway, if there's any way to plow
Yeah,
through
we
this,
need
maybe
to,
Claire will
yeah.
help me.
If you're looking for that other employee that's a stupid, Mike.
Well, I just.
No, that's a good
I
point.
hound them repeatedly, and I really apologize for that.
All right, well, we'll work on that. That's a good
Yeah.
point.
Fortunately, my wife handles it,
Any other business?
because I couldn't.
Okay, with that, we are adjourned.
Thank you.
Thank you.